Todd Hurst, and I'm a cardiologist who specializes in the prevention of heart disease. Welcome to Your Health Questions Answered. Recently, there's been a lot of media attention around the question of whether long-term endurance athletic activity, like participating in marathons, triathlons, Ironman competitions, can actually lead to a higher risk of heart disease. In this video, I am going to answer the questions: is there such a thing as too much exercise? What are the health risks of competing in an endurance athletic event? And lastly, is atrial fibrillation more common in endurance athletes? Before we get started, I will emphasize that this information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. The first point I want to make is that the biggest problem in healthcare is not that people are exercising too much. Many people's health is suffering because they are sedentary. For the most common health problems in our country, like diabetes, high blood pressure, obesity, and several others, the most effective treatment is more physical activity. But the idea that if a little exercise is good for you, then a lot is going to be even better is almost certainly wrong. There is a point where too much is, well, too much, even for things essential for life such as oxygen, water, or food. Research has shown us that the relationship between physical activity and health looks more like this. As exercise intensity and duration increases, we see that the health benefits tend to become less. Most of the health benefits for physical activity happen early on just by getting off the couch. However, the question is there a point where increasing amounts of physical activity can actually lead to worse health? This is not a new question. In fact, legend has it that the very first runner of a marathon, Phidippides, died after running from Marathon to Athens to announce victory over the Persians. And we know that participating in endurance athletic events does have a small risk of death. This recent paper looked at 31 years of triathlons and found there were 135 deaths among almost 5 million participants. The average age of those who expired were 47 years, 85% of them were male. Overall, less than 2 deaths per 100,000 participants, but for those over the age of 60, almost 10 times higher death rates. Long-term athletic activity, Long-term athletic activity can also increase the risk of developing the heart rhythm problem called atrial fibrillation. Atrial fibrillation is the most common heart rhythm problem cardiologists see, and it's increasing at epidemic levels. Most atrial fibrillation is attributed to issues like high blood pressure, increasing age, obesity, and sedentary lifestyle, but interestingly, long-term endurance athletic activity also increases the risk of atrial fibrillation. A recent article suggests there is a threshold of about 2,000 hours of intense training needed to increase the risk of atrial fibrillation in these athletes. Some interesting facts about exercise and the risk for atrial fibrillation: intense exercise increases the risk in men but lowers the risk in women. Moderate exercise reduces the risk of atrial fibrillation in both men and women. And some studies have shown a marked reduction in atrial fibrillation in athletes who abstain from intense exercise. So back to our original question: is there such a thing as too much exercise? I thought about this question when I read an article in the New York Times about a race called the Quintuple Anvil Triathlon, where participants run an Ironman length race every day for 5 consecutive days. While I admire the fortitude of these individuals, it does make me wonder if that is too much exercise. Because my opinion is that there is a point where more exercise leads to worse health, even though there is not good research to prove this. The problem is I don't think we are ever going to be able to identify what that point is, because it's likely different for each of us. And the last point I will make is that while there may be a health risk to intense exercise, that risk is likely small, and you also have to weigh that against the benefits. When I talk to my endurance athlete patients about the benefits of participating and competing in these athletic events, they often talk about benefits like a sense of purpose, accomplishment, camaraderie, and stress relief more so than health. And I think that is reflected nicely in this quote from the New York Times article by a urologist who completed the quintuple Anvil marathon. He said, "I know this is not good for my body, but it's good for my soul." And then insert last ending template.